The earlier you can catch a cancer, the better it is to treat it, the more likely to survival, the less cost, the less infrastructure. So if I was sitting with the Ministry of Health today and they said, what 2 things should I do? Tobacco control, screening. Where we have made progress is quite clear. There is progress in tobacco control. There is progress in a number of national cancer control plans. There is progress on HPV vaccinations. There is progress on early detection. And we can also give tools to individuals who can go back to one of the 120 countries which are represented here, for them to start advocating for accelerated implementation of the plans which we know are in place. And that's where we've identified a real opportunity in the next 10 years, implementing what we know. Where we have a gap is in implementation science. When we look at, say, Europe, and you see that the breast cancer screening rates in one country are A, and yet they're 3 times higher in country B, you say, well, why is that? Why is that different? What's going wrong? What's the policy environment that's led to that? What's the cultural environment that's led to that? But how can we improve it with the knowledge of what's working elsewhere? And so that's the gap that I think exists. And the UICC is announcing at the Congress some significant investment funds into the space of implementation science or prevention across Europe. Well, the World Cancer Congress runs every 2 years, and it actually takes us 2 years to prepare, and not just the program, but also to decide what the emphasis will be, what the track areas will be, what the focus areas should be for our members and organizations and individuals from around the world. And what we try to do is to cover the full spectrum of cancer control. So that will cover, for example, prevention, the risk factors, early detection, treatment, care, as well as palliative care, and ongoing supportive care as well. And with a real let's work on what we know works and how do we share that knowledge. So there's very little breakthrough science involved in the World Cancer Congress. It's more about breakthrough in thinking on how we can take things forward when we go back to our own countries, having been at the Congress for 3 days.
Yes, so is it the science or the advocacy or the policy? Which one takes the major center stage?
We sort of pivot around implementation science, so what actually works on the ground. But we have to recognize the fact that in order to make things happen on the ground, you need to have normally government support, laws, policies in place, or you need the support of other partners and sectors within a country. So it's not simply about science dictating what should be done. What we know is that in order to convince governments around the world to make something happen, embedded in society, you need to have to work with the science and evidence. You have to work on the heart about the reasons why we should do this, that people shouldn't suffer and they shouldn't die unnecessarily. But you always have to work on the pocket and make sure that governments understand the financial benefit of investing in cancer prevention, treatment, and care. So all 3 aspects have to be in place, but not all 3 are driven by scientific evidence.
Yeah, absolutely. Looking at the state of cancer response globally, what insight can you give looking at from the perspective of the various sessions? How did you categorize the various sessions to be able to be as much as possible a true reflection of the state of cancer response?
I've just had a session which was called the President's Panel, and we had 8 presidents of UICC in 2 groups of 4 talking about the past, what we've achieved in cancer control in the last 10 years, and then what is left to achieve in the next 10 years. So 2 panels with people who've probably got tens of years, decades of years of experience working in cancer control, and also have that breadth of view, having worked at a very high level and with the UICC and other organizations. Where we have made progress is quite clear. So there is progress in tobacco control. There is progress in a number of national cancer control plans. There is progress on HPV vaccinations. There is progress on early detection. And there's progress in terms of government engagement in health more generally through universal health coverage or through non-communicable diseases. However, that progress is not as far as it should have gone in order to address the size of the problem that we face. Now, what we can do at the World Cancer Congress is we can highlight progress, and we can also give tools to individuals who can go back to one of the 120 countries which are represented here, for them to start advocating for accelerated implementation of the plans which we know are in place. And that's where we've identified a real opportunity in the next 10 years, implementing what we know.
I think we are seeing a lot of different players at this conference, and sometimes there is this enthusiasm about governments that are actively on board, while there is also less enthusiasm in places where the advocates are struggling to actually make progress. So what are the lessons from that you can share from areas and regions where progress are being made that advocate in areas that are struggling to catch on can actually consider?
Well, across the 180 or 90 countries around the world, there will be some that are leading, there are some that are following, and there are some that are lagging. I mean, that's the truth. And it's not just on specifically cancer. It's normally more generally on the investment in health and the challenges faced by that particular country. And we know that the lower middle income countries, many of them struggle just to generate sufficient cash to put in place an infrastructure for health services which is covering the basics. Now, in many of those countries, communicable diseases are the most important set of diseases that are being addressed. But as those populations get older and they adopt more Western lifestyles, and of course non-communicable diseases and cancer specifically becomes a greater challenge for them. There are several things that need to be done. One is that we need to make sure that any funding which is available in those countries is diverted to the most efficient and effective investments possible. And that means generally prevention. All right, generally, the best buys that come from the World Health Organization, most of them are on prevention. And therefore, that's where we should start. However, as an economy grows and the wealth of that economy grows, then investment in universal health coverage, which protects the poorer and more exposed individuals to cancer, that has to be put in place, and through a public purse, not through private sector funding. So we heard this morning at one of the sessions that a government's primary responsibility has to be the health of its community. The health of its community will lead to the wealth of the country. And so I think a lot of countries, whilst they are struggling at the moment, if they're looking for an investment which will give them, their country, the best chances of growing their economy and helping their people, and potentially being re-elected, then of course an investment in health is such a good way to do that.
An issue I've also been hearing is equity regarding cancer ecosystem. So let's have a brief discussion on that and what is possible in the purview of equity with the goal of improving outcomes for individuals living with cancer in different parts of the world.
Equity has been a theme in the heart of the UICC's purpose statement for many, many years, reducing inequities around the world. It's been the theme for the last 3 years for World Cancer Day. So it's something that we take very seriously. And it's important to understand that inequity, whilst generally understood in the health community as the difference between high-income countries and low- and middle-income countries, inequities exist in cities, they exist in countries, they exist in regions, as well as globally. So there's a responsibility on governments, regional governments, as well as the UN, the World Health Organization and others to identify those inequities and to ensure that over time we don't create more of a problem by putting advances in technology, advances in treatment, advances in the way that we deal with cancer only in high-income countries, because it will get worse. At this particular Congress, what we are able to show through sharing knowledge and understanding is what are the steps to be taken to address inequities in a particular country. Is that health promotion? Is it making screening available in rural areas, for example? Is it about making vaccinations available to all young girls for HPV so that they essentially reduce their risk, if not eliminate the risk of cervical cancer in the future? That's a key inequity. We know how to stop cervical cancer in the future by giving young girls HPV vaccination. So that sort of thing can be a real indicator that we are bypassing the inequity challenge by making it universally available to all. So as ever, there's lots of challenges in the cancer control space, but I do believe that we have the wherewithal to address the inequity challenges that exist today through the knowledge that we have already.
So let's talk about UICC leadership. Let's talk about the progress under your leadership and what you think the vision for the next chapter of UICC should look like.
Well, I've seen great progress since I joined 15 years ago in cancer control. If I start at the top and I'll work down to national level. When I came into UICC in 2009, the issue of cancer in the NCDs had never been discussed at the United Nations. And since then, we've had 3 meetings, 11, 14 and 18, and we have a 4th meeting in 2025. It has got massive coverage, and countries around the world at a government level now have more NCD and NCCP, National Cancer Control Plans, than they had when I came in 15 years ago. One could question whether they're being implemented appropriately and whether they're being funded appropriately, but nonetheless, the baseline of plans are in place. We've seen great progress in tobacco control. And the industry has been suffering, struggling with its traditional cigarettes, which is why it's moved to e-cigarettes and vaping as a long-term solution. But nonetheless, we have seen an implementation of laws around the world, plain packaging, increasing tobacco taxation, which has actually addressed tobacco, which at the end of the day is the largest risk factor for cancer around the globe. So I've seen lots of progress in different areas, advances in diagnostic techniques, advances in how we can treat an individual with very personalized medicines, advances in radiotherapy, even advances in surgery. So advances in all the right directions. So we're in a better place now than we were when I was 15 years ago. He came here 15 years ago. Now, where are we going? I think that the biggest challenge is the knowledge that we have today and the technology we have today, making it available to all. And by way of example, let's talk about medicines. There are some cancer medicines that are very effective, that have been around for 15, 20 years, that are still not available in low and middle income countries. That's morally irresponsible. As a generation, we shouldn't allow that. Pathology and diagnostics capability in LMICs is just really weak compared to what it should be in order to identify cancers. Because of poor education, people present too late in many countries, stage 3 and 4, which makes their treatment almost impossible, survival very low, and also the cost of that treatment is extremely high, fueling the general belief that cancer treatment is too expensive. If we catch cancer at stage 1, 2, it doesn't have to be expensive. So I think we've got a lot of opportunity going forward in the next 10 years, but then there are other threats that are around the corner. Antimicrobial resistance, which is prevalent now around the world and will grow year on year, means that the chances of you picking up an infection when you're being treated for cancer will increase over time, and the chances of that being treated well are reducing because we aren't investing in antibiotics or antifungals as we should be. So there are new threats appearing for cancer treatment and care around the world, over and above where we have the capability to develop new treatment solutions. So I'm optimistic about the future, but I'm also wary that there are other challenges that we need to face.
There is this issue around bringing attention to different diseases. For instance, infectious diseases, HIV continues to massively get attention compared to NCDs. But I'm seeing a trend within the NCD ecosystem, even cancers. We have some cancers that are front and line that people are always talking about. They attract massive grants. For instance, conditions like breast cancer, HPV, these are getting attention. Are you concerned about some cancers not getting this attention, bringing the inequity issue back home? Or how do you see this issue being faced and dealt with?
I'm not worried, because in the background, and what we've heard already at this conference, is that ministers of health generally are very committed to the concept of universal health coverage. So the challenge we have there, if they're committed to universal health coverage, that means they have to cover the full spectrum of diseases, and also they have to make sure that there's no financial crisis caused within the family or an individual in order to get access to that treatment. So the challenge we have is not necessarily, will they go for disease A rather than disease B? It's more about, will they get enough funding to lift the percentage of GDP they invest in health, to lift everything so they can deal with the multiplicity of diseases which they face in their country. And although cancer is called a non-communicable disease, you mentioned there human papillomavirus, which is communicable, leads to most cervical cancers. There are other, Helicobacter virus. There's also stomach cancer. You've got hepatitis, which leads to liver cancer. So cancer is a lot of different cancers, and some of them are related to communicable diseases. Most of them in older age are in individuals that have hypertension, maybe a heart problem. It becomes complicated when people get older. So I think it's appropriate that health ministers should look at the whole. They should invest in universal health coverage, and then they should adapt that to their own local situation. In a country like Rwanda, average age of the population is, I think, 22. The investment profile will be different from, say, a country like Japan, where the mean average is 46. Now, the profile of diseases which the average 46-year-old has to a 22-year-old in a high-income country versus a low-income country is very different. And we have to give respect to the Minister of Health to ensure that their investment in universal health coverage covers the disease spectrum which they face and the projected one in the next 10, 20 years. So I would hope that would be the policy applied by Ministry of Health, and they wouldn't necessarily go down by a disease A versus disease B approach.
I think you've seen this sector from a much broader perspective and closer perspective. In spite of all the challenges, what are the quick wins that you think, if these countries just do this, if we can just do this, we are going to make a whole lot of difference with these quick wins?
Quick wins, massive improvement in tobacco control. Lift the prices of tobacco, plain packaging, stop their use in public places, ban their use in other areas like in government buildings, educate the population on tobacco control. Try to eliminate it as quickly as possible. Wherever you are, go down, because that will stop cancers in the future and many other NCDs. Second thing, screening. Improve screening so you can identify cancers early, whether it's breast, colon, cervical, or lung. Improve screening. The earlier you can catch a cancer, the better it is to treat it, the more likelihood of survival, the less cost, the less infrastructure. So if I was sitting with the Ministry of Health today and they said, what 2 things should I do? Tobacco control, screening.
Policy sometimes takes very long time to enact. Meanwhile, every year we are recording millions of deaths for those kind of conditions that those policies are expected to address. Can we close this gap much quicker? And what are the best case scenarios or best examples that are out there that should be highlighted?
It's hard to say how you can speed up the legal process country by country, because the legal process country by country is different. What you're hinting at is that in most countries, despite those differences, it still takes too long. Now, about 10 years ago, UICC identified law as being a major barrier to the implementation of policies, laws on, for example, tobacco control and other products, goods which are poor or risk factors for cancer. And we established the McCabe Centre for Law on Cancer. Now, that operating model is quite cool because what it does is it trains up lawyers who work in health ministries around the world on the best practice to implement laws within their country and how to, for example, take on the tobacco industry, who will immediately employ lawyers to counter the arguments that they put forward, but not just train them from a single perspective, but to link them with many other lawyers working in health ministries around the world so they can continue to support each other in order to progress laws at a national level. Because without doubt, the majority of challenges we faced in risk factors, for example, require law change, and therefore, by definition, you need good lawyers who are trained to take them forward, because we know the industry, particularly the industries which are create the risk factors for cancer, they will defend the status quo. So it's important that they do work together. Having said that, there's a lot that can be done without law. There's a lot that can be done with law. You go to any country and you look at their current cancer treatment center or the way that they deal with cancer at the moment. There are no laws that dictated that. It was about the public saying we need to be doing something on cancer, and governments responding to that. They didn't pass a law. What they did was they found the funding available and they implemented the investment needed in primary healthcare, secondary care, and tertiary care. There was no law in there. So I think law plays a role, particularly when there's an adversary, but actually government shouldn't rely on laws to implement the necessary infrastructure to support cancer patients through their journey.
What is your perception about gaps that are still existing that should be filled?
I'm very comfortable that we're doing great research for new medicines, new technologies, new treatment, new diagnostics. I'm very comfortable in that space. And most of that is driven by the private sector. And that's good, because they are incentivized and there's lots of work in there. Where we have a gap is in implementation science. When we look at, say, Europe, and you see that the breast cancer screening rates in one country are A, and yet they're 3 times higher in country B, you say, well, why is that? Why is that different? What's going wrong? What's the policy environment that's led to that? What's the cultural environment that's led to that? How can we improve it with the knowledge of what's working elsewhere? And so that's the gap that I think exists. And, UICC is announcing at the Congress some significant investment funds into the space of implementation science on prevention across Europe. And we're hoping to do more of that in the future. Go back to what I said at the beginning. A lot of the challenges we face in cancer control is implementing the knowledge that we have today. And there's lots of things that work. How do we share it without necessarily doing further research? We've done the research. It's working. How do we make it work? So I think that that's the area where I think there needs to be more investment in research in the future.